Hello and welcome to the live session about joint replacements. I'm your host, Gaurav Thakral, and I'm delighted to have with us today Professor Dr. Raju Vaishya, Senior Consultant Orthopaedics and Joint Replacement Surgery at Indraprastha Apollo Hospitals, New Delhi. Professor Dr. Raju Vaishya is one of the most sought-after orthopedic surgeons in India with more than 3 decades of experience in performing complex surgeries, including knee and hip replacement surgeries. Dr. Vaishya has authored 2 books and has published more than 700 scientific publications. He's a renowned member of numerous medical associations and organizations around the world, such as the Royal College of Surgeons of England and the Indian Orthopaedic Association. आज हम बात करेंगे जॉइंट रिप्लेसमेंट्स के बारे में, व्हाई इज इट डन, क्या प्रिकॉशंस लेनी चाहिए, टिप्स फॉर द पेशेंट सफरिंग विद जॉइंट पेन, एक्सेट्रा. We are also streaming this session as a podcast by the name Hello Apollo on Spotify, iTunes, Google Podcasts, Amazon Music. I thank our viewers and listeners for tuning in and making us grow in such large numbers. Once again, I welcome our very own Professor Dr. Raju Vaishya to our live session and podcast.
नमस्कार, मेरा नाम डॉक्टर राजू वैश्य है और मैं अपोलो हॉस्पिटल दिल्ली में ऑर्थोपेडिक डिपार्टमेंट में पिछले 26 साल से काम कर रहा हूं और मेरा स्पेशल इंटरेस्ट आर्थराइटिस के डायग्नोसिस, उसका ट्रीटमेंट, ऑपरेटिव एंड नॉन ऑपरेटिव ट्रीटमेंट दोनों ही रहे हैं और इस पर मैंने काफ़ी विस्तृत रूप से रिसर्च भी की है जो कि वर्ल्ड के सभी कोने में पब्लिश हुई है बड़े बड़े जर्नल्स में. और उसी के एक्सपीरियंस से और अपने नॉलेज और रिसर्च के बेसिस पर मैं आज आपको कुछ जानकारी नी रिप्लेसमेंट, हिप रिप्लेसमेंट के बारे में दूंगा.
Thank you, Doctor. So we have few questions lined up for you. So the first question is, what is the procedure of joint replacement surgery?
Joint replacement surgery means when a joint becomes diseased or arthritic, the smooth surface of the joint becomes rough and bones rub against each other, causing pain, deformity, swelling, and so on. So in joint replacement, when the bone has totally exposed and the cartilage is completely lost, there is no other option but to replace the joint. That is the end stage of arthritis, where with special jigs, we remove the diseased bone and replace it with an artificial joint component. So it is like a surface replacement over the bone, and the component is fixed to the bone with the help of bone cement or sometimes screws. So this is basically the joint replacement surgery. Here we do not, some people think that, we amputate the knee and then put an artificial knee instead. No, we just replace the deceased part of the bone and resurface or replace it with artificial components. So the original tendons, original muscles, skin, and other soft tissue of the patient remains as it is.
Dr. Saab, what are the complications of a joint replacement surgery? Is there any risk to life because of joint replacement?
Usually joint replacement is now a very safe surgery. It is being done in increasing large numbers across the world for over more than 5 decades. So joint replacement is considered one of the safest surgery in orthopedics with outstanding results. But rarely the complications can happen with any surgery like in joint replacement. These could be related to patients' medical conditions. If somebody has severe heart disease, lung disease, kidney disease, etc., may get exacerbation of their existing disease or sometime complication related to that disease. And hence, such patients should be thoroughly screened before the surgery, optimize their condition with the help of specialists, which we have in our hospital, And then we undertook this surgery with great care. And hence, in such patient, it is recommended that these procedures should be done in a center where multi-specialty facilities are there. And so in case of any adverse event that happens, the patient gets immediate treatment and care. So that is one. Sometimes infections can happen, but in our hospital, the incidence of infection after such procedures is less than 1%, which is quite acceptable. And even if it happens, it can be controlled if properly and diagnosed in early period of infection. Rarely there could be problems related to the positioning of the prosthesis, etc. But again, with the experience of the surgeons and the staff that is supporting you, these are extremely rare. I would say 1 in 100 or maybe 1 in 200.
Dr. Saab, does the joint replacement limit the common problem of arthritis? Is this the permanent solution to pain because of arthritis?
Yeah, that's a very good question. Most people worry about having joint replacement surgery even if they are disabled with severe arthritis for these reasons. Joint replacement actually can transform your life significantly. So not only the pain goes away, but your disability, your ability to walk, deformity, walking style, climbing stairs, doing activities of daily living, etc., are completely changed to near normal. So joint replacement is a very successful operation, and with the current prostheses that are available, joint replacements can easily last for 20 to 30 years. And hence, if done in elderly patients where usually the arthritis occurs, it may be one-time solution for rest of your life. So one-time investment in your surgery, and then you need not to take any painkiller or do anything related to your previously damaged joint due to arthritis. So, but in younger patients who have arthritis due to any disease like ankylosing spondylitis, tuberculosis, or any other cause, those patients may require revision surgery if they live longer, because their joint replacements were done in early age. We have done joint replacements, unfortunately, in some patients who are totally disabled because of rheumatoid arthritis and ankylosing spondylitis in the age of 20 and 25 years. Usually, the joint replacement is done in age 50 to 60 years or above. And the maximum age at which I have done joint replacement of the hip is 104 years, and knee replacement at the age of 93 years, and that is a world record still. So it's quite a safe surgery even in elderly patients and also in young patients, but 90% of our patients are like 60, 70 years old.
That's brilliant, Doctor. Doctor, what is the success rate of different types of joint replacements? For example, knee replacement and hip replacement, or bilateral joint replacement?
Sure. Now almost all the diseased joint of the body can be replaced, but the two most commonly done joint replacements are knee replacement and hip replacement, followed by shoulder replacement, elbow replacement, ankle, wrist, finger joints, and so on. The success rate of knee and hip replacement, as I said before, is more than 20 to they last 20 to 30 years, and the success rate is almost 98%. But the joint replacements of the other part of the body, like shoulder, elbow, wrist, ankle, may not last that long because they are being recently introduced, and most surgeons do not have enough experience of doing it, but still they can last for 10 to 15 years without much problem.
Dr. Saab, how long does it take to walk normally after a knee replacement or a hip replacement? Can a person run after a joint replacement?
Yeah. Usually the recovery after hip replacement is faster than the knee replacement surgery. And patients after hip replacements feel almost normal after 3 to 4 weeks, whereas knee replacements take slightly longer, maybe 6 to 8 weeks to recover, but they can start walking from the very first day of their surgery in both these operations. And now we have aggressive rehabilitation program where patients are given adequate pain relieving measures so that they can start standing and walking from very first day of the operation. And that actually helps a lot of people to mobilize on very first day. Some people are so good and active and motivated that they do not require any support or even physiotherapy. They can do all the exercises before which they have learned prior to surgery. So it all depends on the patient, how motivated he is, how cooperative it is, and usually the recovery is very good. And after hip replacement, most patients tend to forget that they had hip replacements at the age of at around 2 to 3 months, where knee replacements may take about 3 to 6 months to have the same effect. But after that time, they sometimes tend to forget that they had the surgery done.
Should be avoided after a joint replacement, say knee replacement or hip replacement, after the surgery is done?
आजकल के जोड़ों जो हम आर्टिफिशियल जॉइंट्स लगाते हैं उसके बाद लगभग सब एक्टिविटीज अलाउड हैं, पर दो चीजें स्पेशली जॉइंट पर ज्यादा स्ट्रेस डालती हैं वो अवॉइड करनी चाहिए, लाइक पालती मार कर बैठना और इंडियन टॉयलेट पर बैठना। इसके अलावा मरीज लगभग सब कुछ कर सकता है और ओकेजनली ऐसे बैठने में कोई दिक्कत नहीं, पर रेगुलर बैठने में जोड़ पर ज्यादा स्ट्रेस पड़ता है, जोड़ जल्दी घिस सकते हैं या लूज हो सकते हैं। इसलिए आर्टिफिशियल जॉइंट की लाइफ बढ़ाने के लिए इट इज एसेंशियल दैट वी अवॉइड दीज थिंग्स। इट इज सिमिलर टू buying an expensive car like Mercedes and driving it on a good road or a rough road. If you drive it properly, the life is long. If you do not care about it, the life is less.
There is very interesting question, Doctor. Does cold weather affect the artificial joints? We say in India that in winters there is more of pain in the joints. So does that affect the artificial joints as well?
Usually the weather does not affect the artificial joint, but since knee is a superficial joint compared to hip joint, which is covered with a lot of muscles all around, the effect of weather is experienced more on the knee with or without joint replacement than in the hip joint. And sometimes people can have slight feeling of pain or stiffness or sensation after knee replacement for a few months only, especially if they expose their knee to extreme cold weather or to AC, etc. But it tends to subside after a while.
Doctor, what is the most common reported problem after a joint replacement surgery, and how can...
See, the most common complaint after joint replacement surgery is some people feel pain, stiffness, or difficulty in getting up from chair, weakness of the thigh muscles, sometimes stiffness of the joint, and all these require good rehabilitation or physiotherapy. And hence, we recommend that even before joint replacement surgery, the patient should be taught about these exercises so they can start even before surgery, so they can activate their sleeping muscles which were not working when they had arthritis and severe pain. So if they do that, they recover much faster than if they do it later. So doing proper exercises is very important. If you can do it yourself, very good. If you need support, then physiotherapists are there to help you, and they can make you really good in short duration of time.
So, like it happens in the case of organ transplants, we have heard that there is, possibility of rejection of the organs. So like in case of liver and kidney transplants, can a body reject a knee or a hip implant that we use for the joint replacements?
These implants are made up of metals which are totally bio-inert, but sometime, very rarely, 1 in 100 or 200, a person can have metal hypersensitivity to these metals of the artificial joint, and hence nowadays we also have the option of coated implants, where the metal is coated with special layer of coating like tibium nitric oxide, and hence there is no release of metal ions in the joint after surgery and no chance of metal reaction. And we are using these joints here in Apollo Hospital also.